All right, well, it looks like the waiting room is slowing down a little, and I know we have a very, very full agenda today, so I think I'm going to get us started. We're not going to really dig into the very exciting stuff for another couple minutes, so hopefully everyone will have joined us by then. This event is being recorded. I know we all probably had to click that OK button already. So next slide, please. So welcome to our NAC quarterly champion convening. We are very excited to be here with you all today. And today we're really excited to be talking about small towns and big initiatives and the launch of our Rural Resilience Innovation Hub. I think as many of you know, there's some really exciting stuff happening in California, and it's really complicated and there's a lot to learn. And we're really excited to be joined by a number of amazing guests today to share with us and help us learn a little bit more and hopefully help us figure out what we want to dig into in the future. So next slide, please. My name is Catherine Stewart, and I am the Director of Strategy and Operations at the Population Health Innovation Lab, which we lovingly call PHIL. And really, PHIL's mission is to design, catalyze, and accelerate innovative approaches that advance health, well-being, and equity. And we have had the pleasure of serving as the backbone for the Northern ACEs Collaborative for the last 5 years, and are just excited to be here with you today. Next slide, please. All right, just a quick welcome and housekeeping. We are seeing a lot of new faces here, so thank you for joining us. And we would love it if you would share your name, your organization, your location, and your favorite summer activity in the chat. And if you're new to NAC, how did you hear about us? We're really excited to learn how you found your way to hang out with us today. And then a little housekeeping. So as you saw, again, this meeting is being recorded. We hope that you can spend this time with us and be present and be on camera if possible, but we also know it's very important for you to take care of yourself. So if you need to step away, refill your water, or you're just not in a space to be on camera, that's totally fine too. We are going to cover a lot of content today, and we do hope that there's time for questions and discussion, but we really welcome you to place questions in the chat as we go along so that if we don't have time to get to your question, we're able to circle back and find answers to the questions that are burning in people's minds as we learn about all of these new and exciting things. Next slide, please. And now I'm going to hand it over to Megan to do a land acknowledgement.
Thank you, Catherine. Good morning and welcome, everyone. We're going to start with some grounding in our land acknowledgement, and we'd like to say that the Population Health Innovation Lab team respectfully acknowledges that we live and operate on unceded land of Indigenous peoples throughout the U.S. We acknowledge the role Native American, Alaska Native, and tribal nations have today in taking care of these lands, as well as the sacrifices they have endured to survive. I am joining today from the unceded and ancestral lands of the Chumash people, more specifically the Ventureño Band of Mission Indians. And we encourage you to learn more about what tribes are located in your areas. Thank you. I'm going to turn it back over to Catherine.
Thank you, Megan. I'm going to hand it over to Heidi Mendenhall, the Executive Director from First Five Tehama and also our NAC Steering Committee Chair, to go over the agenda and provide a little grounding. But before I do so, Heidi, maybe you and I can look through the chat and see what people have shared in terms of their favorite summer activities and how they found their way to be with us. Are you there?
I've seen a lot of ice cream, a lot of ice cream having, which I can put that in as my secondary as well. That seems lovely.
For me, that's your
right. That's not a summer specific love. That's always. And paddleboarding. Oh, that's fun. Lots of paddleboarding. And yeah, what's popping out at you, Catherine?
I love to cook summer dishes, aka lots of lemon and fruit. I can relate to that. The farmer's market fresh summer produce is also one of my most favorite things.
Yes.
Awesome.
Well, thank you so much, everybody, for being here. I have the pleasure of being the NAC Steering Committee Chair. I think I'm rolling into my second, maybe halfway through my second. I don't know. I lose track of time. It's all a funky construct anyway, right? And I get to participate in both the planning and really grounding in our vision and mission. And so we came together. This is the second time we've been together kind of since the launching of our NAC 2.0 vision and mission. And we had taken a year inward at really fostering what we wanted to see. We came together last March, and I am still riding the energy from that. It was an amazing day, and I know some of you on the call are probably still riding that energy. I just found out recently that a local entity in Tehama County invited Stephen Sawyer to come do their staff training, and so there's lots of opportunity to continue that conversation and move forward. And so we're really excited to have you here today for that. I know, so wonderful. So we'll start with our grounding and just kind of revisit that taxonomy and purpose and mission and how we come together and why we stay together. And then we will dive into a description and a little bit more actionable understanding of what our Rural Resilience Innovation Hub launch will look like. And then we are invited by some amazing guests. As Catherine mentioned, there's so much going on in the state, and it's almost that it's so much that it can be overwhelming to pull apart, and it is so meaningfully connected that it can also be hard to find the separation and the connections. And so that's our goal today, is to both take them apart individually so we have an opportunity to think about ways that our rural communities can engage with these statewide initiatives, and both giving our information and what we know to be true of our communities, and both receiving information and supports and resources as well. And we hope to find the connectivity, right? We hope to find the areas that they overlap. So thank you so much to we're gonna do it. Gretchen and Rick and Soheil and Rachel and Rosemary for being on the call. I asked them to put the names there because I wanted to honor you, and then I just read through them super fast. So, I can't win, but it is what it is. So we are grateful to have you here. We hope that we have opportunities for you to connect with the programs, and also everybody on the call to take down contact information so you can ask direct questions as well, and the conversation goes on beyond. So go ahead. You want to advance for me? So this is a morphing and an adaptation of one of Maya Angelou's favorite quotes, or famous quotes, that once you know better, you will do better. And so that's kind of the grounding for our 2.0 lens, that we take this opportunity to come together, to learn together, to know more so that we can do more and do better. And that also means approaching every space that we enter in our NAC world with curiosity and a humbleness to be ready to learn. And so that is what we come here, and that's how we invite you to come here today as well. So why are we here? We, for a year, spent time really grounding in what it was to be rural and what it meant to be Northern ACES Collaborative. And we see a Northern California in which all residents have everything they need to live resilient, happy, and healthy lives. So we are First Fives, we are community action agencies, we are philanthropic entities, right? We are the people who step forward and come together as NAC champions at these quarterly meetings. And so it's really important to ground in that we, as it's all of us. Our mission, how we aim to do this, is really through addressing and promoting what we know to be true in our both research and experience, and to promote resilience through addressing generational trauma and really focusing on a collaborative approach and using the relationships that exist. Personally, that for me is about coming up against a single story. So we all have single stories in our heads, and one single story that we often hear about the rural area is that we lack. We don't have resources, or we don't have enough. And this mission is saying, no, we're going to come up against that single story and say, we do. We have the capacity and the relationships and the skills and the knowledge to come together and promote and support. And it's about a flip and really putting that single story on its head. And we do this through using the resilience and improving the health of the communities we serve. And we aim to do it with some specific strategies and approach. And so those specific strategies and approach are, next slide, please, to share and learn, to generate and adapt and expand. And you'll notice that those verbs are really asset-based, right? And they're growing on something. So it doesn't imply that there is nothing to grow upon, but rather to use what we have and the knowledge we have and expand that, and to use that generative understanding and dialogue to continue innovating and to continue expanding until we can acknowledge and support all of our community members. And importantly, we want to acknowledge, one more slide, that we do this with both the regional approach, right? And that we do it through identifying and acknowledging that there are multiple realms of trauma. And so this is something new in the last year and a half that NAC has adopted, this multiple realms of trauma and opportunities for resilience model, so that we can look at all areas that are impacting our families and not be siloed or singly focused. So that's a quick kind of fast rewind of a year and a half that the team spent together and doing focus groups and conversations to really ground in what we are hoping to achieve and will move forward in the Rural Resiliency Innovation Hub. So thank you for being here and joining us on this journey, and thank you for being part of the we.
Thank you, Heidi. So now I'm going to turn it over to Sue Grinnell, our fearless leader at Phil, who is going to talk a little bit more about our Rural Resilience Innovation Hub and how excited we are for the launch of this. Take it away.
Thank you so much, Catherine. I'm excited to be with you today. So if you just heard from Heidi, from the strategic planning work, out of that was this solution to address the needs. And the solution really is the creation of this Rural Resilience Innovation Hub. So we're excited here to be with you and to share this vision with you. And you may ask, what is an innovation hub? And here's some key activities that often in innovation hubs occur. One is really, it's a space or a container to facilitate connections and interactions between a variety of different disciplines, and really with the idea of sharing ideas, knowledge, forming partnerships. The other action really is this notion of cross-sector collaboration. So we are here today to really promote knowledge exchange, really in service to tackling complex challenges you are all dealing with, and just helping to begin to think about new opportunities through these different approaches. We also are big believers in prototyping and experimentation. So that's a space that we really want to be able to, like you've learned about all of this, you're trying to figure out how to implement, how can we support you in actually trying some things out in a way that's going to be working. So thinking about prototyping, testing, iterating, really again in service to those that we care about. And last but not least, really another action is data-driven decision-making. We've spent a lot of time and shared at the NAC Summit an amazing amount of data that's really helpful for us to help to gather insights, measure our performance, and inform next steps. Next slide. So often in our work, we use the practice of a design challenge question, and it's a very different model than a public health approach, which is a logic model. First you do this and that, and magically this is going to appear. It's more of an invitation to set out what our intentions are, and really saying to you, this is our question. And the question really is, how might we decrease trauma and toxic stress through generating equitable and innovative solutions that improve population health by creating a community-led rural resilience innovation hub that respects the local culture and tradition. So this is our intention. We are now inviting all of us in, all of you here, to help us to really answer that question. We don't have the answer, but it implies that there is a solution and or an answer. And again, we're inviting you in. Next slide. So just briefly, today we are here. We are launching the Innovation Hub with a focus on really sharing these programs. So you're going to hear a lot of information. Really, I'm excited about that. And it's really just also in service to increasing the capacity of our Northern California champions to address trauma and promote resilience to improve the health of the communities that we serve. So at this point, we have this vision. We know there is a need, and we are seeking partners as well as resources, right? So our next event is going to be in Reading. It's in person, which we're very excited about, on October 22nd. And all of these, after that, we don't have exact dates, all moving towards our next summit, which will be in Northern California in October. So more to come on that. So with that, I think I'm going to turn it over to Megan.
Thank you, Sue. I can't help but get so excited when you talk about all of that, the launch and all of the work that's gone into it. But we want to keep on schedule here. So I just wanted to briefly share a slide with responses to our registration survey. We asked folks who registered what their familiarity is with the topics that we're planning to cover today. And just a few things to point out. It seems like when it comes to CalAIM, most folks have heard of it. They were either moderately or slightly familiar with the topic. But you can kind of see that green bar, like not familiar at all, kind of going up as we go down the line of these topics. So definitely looking forward to sharing more about CYBHI, about safe spaces, about community schools. Again, this is just a quick peek for you. What I also want to say is we did ask in the registration, and we had about 90 people registered as of this morning, how many folks attended our NAC Summit in March 2024, and only 13% did, which means that I think we have a lot of new faces on this call, and so we just wanted to take another minute to welcome you. And I put in the chat the link to our NAC website where you can learn more and sign up for our newsletter. So with that, I'm going to pass it back to Catherine.
Thank you, Megan, and thank you, Sue. I think we're doing a really good job of running, on time. So I think if anyone had a question or two about what an innovation hub is or what we're trying to do, we could spend a minute there. So I'll just be quiet and see if anyone wants to speak up. Is anyone so excited? I see some thumbs up. Okay.
I am.
I'm very excited. Okay. Well, as Sue noted, we're about to kind of take our first step and dive in and spend some time sharing and learning. And I think as mentioned, or Megan mentioned just now and earlier, we had a summit in March, which was very exciting, very well attended, had amazing energy. We were really excited. And what we heard from people was that there was a lot of interest and perhaps intimidation or confusion about what some of these big state initiatives are, and that people wanted to learn more. And so we thought this would be a really good first step to dive a little deeper, but not too deep, and provide just some basic information on a number of different initiatives. So we're starting with CalAIM and specifically the PATH CPI, which I will spell words out in a moment, because I know that often when these acronyms are thrown out, they're thrown out in a way that assumes that everyone knows what they are, and that's just not true. And so I just want to thank Gretchen Schroeder and Rick Rawson for being here with us today. Gretchen is a principal in community health consulting, and she supports Health Begins, who is a facilitator for one of the PATH CPI collaboratives. And Rick Rawson is the chief strategist and co-founder of HC2 Strategies, and he also supports number of the PATH CPI collaboratives. So next slide, please. All right, so we don't expect you to necessarily remember all of these. We will distribute the slides later, but we thought it would be good to start with just a few definitions of all of these terms that we throw around. So CalAIM is California Advancing and Innovating Medi-Cal, and it really is a multi-year effort to transform Medi-Cal and make it integrate more seamlessly with other social services to really help support some of our most vulnerable members of Medi-Cal. PATH is an initiative under Medi-Cal, and don't worry, I have a graphic next that kind of explains it all maybe a little bit better, but PATH stands for Providing Access and Transforming Health, and it's really an initiative that's designed to address gaps in local organizational capacity and infrastructure for those trying to implement CalAIM services throughout the state. The CPI, or Collaborative Planning and Implementation, is a part of PATH, and it's really a program to support the regional implementation of CalAIM, on the ground in small regional and county groups, and really support addressing topical implementation challenges for those that are trying to tap into these new services. And most specifically under CPI, it's topical implementation challenges related to ECM and community supports. So ECM is Enhanced Care Management, which is a new benefit under Medi-Cal that provides really a whole person approach to care and really addresses the clinical and non-clinical needs of the high need Medi-Cal beneficiaries that are enrolled in managed care health plans. Community supports are services that help address members' health-related social needs, not just their clinical needs, to help them live healthier lives and avoid higher, costlier levels of care, and really includes support for things like maintaining and securing housing, medically tailored meals, and other community-based services that were formerly not supported under Medi-Cal. Next slide, please. So CalAIM is a huge initiative in the state with many really amazing programs and supports that are new and exciting to really help improve the health of our Medi-Cal members across California. And there are a number of different pieces under CalAIM, but we, as I said, are focusing on PATH and specifically support for enhanced care management and community supports, as you'll see here, and the Collaborative Planning and Implementation Initiative. And so there are lots of other pieces, and we hope maybe in the future to dig a little deeper. And as you'll learn soon, if you tap into your local PATH CPI, they really can also help you make sense of the pieces that you are able to access. Next slide, please. So with that, I'm going to hand it over to Gretchen and Rick, who we've invited here today because the collaboratives that they represent are regional, and they include the counties that are in our rural Northern California region, and really have so many amazing things they can offer to support you in your work to tap into these services. So with that, Gretchen and Rick, I'm going to hand it over to you.
Great. Thank you, Catherine. Hi, everybody. My name is Gretchen Schroeder. I do work with the Northeast Collaborative, which includes Latham, Modoc, Shasta, Siskiyou, and Trinity counties. And we are really focusing on how do we implement enhanced care management and community supports, and how do we do this with breaking down silos that we're starting to work together to do more care coordination. And I would love to invite folks to join us. We're not just for those folks who are actually providers of ECM or community support services. We're looking for folks who are, working with individuals who could benefit from these services, referral partners, community members. So we really encourage everyone to jump in so that we can make this effort more successful. And Rick, I'll give you a chance to jump in here too.
Yeah, thank you. I'm Rick Rawson, and with HC2 Strategies, and we, in addition to 9 other collaboratives, operate the NorCal Collaborative, which is the 10 counties that you see there on the slide. What makes these counties together is they all went through plan change from a 2-plan model in Medi-Cal to partnership health plan here in 2024. And so, as you know, if you live in any of those counties, there's many separate communities that are represented there. And so the collaborative brings together, improves cross-county learning. People learn from each other. Placer County, for instance, was a whole person care county that had a little bit of a head start. So they've been able to share with others. But within that, we also support local community development. But as Gretchen pointed out, the collaborative is a place that we really invite all stakeholders. If you work with Medi-Cal members, you may be in the best position to figure out how to connect people to the services that Medi-Cal is offering under CalAIM. The idea is for it to be a very person-centered approach. And that means that many organizations that have not traditionally provided Medi-Cal services now need to get engaged in order to make the people they care for aware of and be able to access an amazing suite of services that now are available to help their health and well-being. Next slide.
So each of our collaboratives, yeah, we develop an aim statement of what we're working on so we can start to focus our efforts. So for the Northeast, which I get to facilitate, we are working on improving coordination of ECM and community supports referrals among local providers. And we are measuring that by provider satisfaction. We know there's a dearth of providers, maybe not in Shasta County, but in the frontier counties. And so we want to make sure that people feel like it's a good investment of their time. They're getting a lot out of these programs and are seeing the benefits and the people they serve. Next slide, please.
And this is our aim statement for our collaborative, and we're really doing the same kind of thing, but we call what we're doing building that connected community of care, because it goes beyond just the clinical care providers who have traditional connections to building an entire community that is connecting people in this person-centered approach. And then really support delivering these services by improving equitable access and utilization. And in rural communities, that's a big deal, because oftentimes people who live in rural communities do not get equitable access to services. And so a passion in our collaborative is really about anybody that lives in a rural community. How do they access the care that they are entitled to and eligible for within the Medi-Cal program? And we look at that through the utilization of ECM and community support services for eligible Medi-Cal members. Statewide utilization of ECM is well below what the state believes is possible in terms of who they believe is eligible. So there's significant work to do in all of our communities to really do a better job connecting people to the care that they have available under this program. Next slide. Go ahead, Gretchen.
Thanks. So this is my favorite part of CPIs, is really bringing folks together across sectors, across different focal areas to really, work with individuals to, do their care coordination, but also to link them to housing services, meals, medical respite. There's all kinds of services that are now available through Medi-Cal under ECM and community supports. And one of the things we really like doing in our Northeast Collaborative is trying to build out our networks. And so, the slide is great. It really shows the breadth of who we want to engage with. And I will say, again, in Shasta County, we have a lot of folks coming together. In the frontier counties, we're still building up the network. But I do see a few folks here from First Fives, and I think that is a really great organization to bring into our collaboratives. You guys work with a lot of families who could benefit from these services. So we would love to engage with you guys and have you, think about how do we make the referrals, the connections for these families into these services. So I love thinking about that. We have street medicine teams we engage with, which are, a really important part of care for those experiencing unsheltered homelessness. Counties, I can't tell you enough how much we want to engage our counties. You guys are key to a lot of this effort. And then I think the other piece that's been fun is that we do, for the first time, are really bringing in the Medi-Cal managed care plans into all of this work. ECM and community supports are run through them. In our Northeast Collaborative, we just have one plan, Partnership Health Plan. And I think trying to build those new relationships and really learning from each other has been important. CalAIM is new, even though we've been doing this for 2.5 years. We're all still learning. We're all still doing process improvements to really strengthen these systems and strengthen the care that we're providing to folks. Rick?
Yeah, and what I would add, Gretchen mentioned a little earlier, it's really about breaking down silos. And traditionally, social services were often offered through very siloed types of organizations and care models. And really what CalAIM is suggesting is that we array the services available around with the Medi-Cal member at the center. And that requires a whole different level of cooperation and participation. And instead of breaking silos, we like to think of people coming together to actually make what they do more effective. But it is breaking down the barriers that stood between organizations and the people that they're really meant to serve. And that's why we believe that the CPI should be a very broad and open table, and anyone interested for the advancement of care to people they serve have a seat at that table. It is a community of belonging around that. So thank you. Next slide. So this is a slide that we show to, because we have monthly meetings, and oftentimes people think, well, that's what the collaborative planning and initiative is this once a month meeting. But really, it's much more than that. It's really about how we form a system of care and connect it together. And we have a lot of offerings around that. So CPI participants have available coaching circles. Our provider forums and coaching circles came out of a rural community in Northern California, and now that's a statewide initiative where providers from around the state engage and get involved and share in peer-to-peer learning. But it gives people news updates, and many updates are coming from DHCS. I think escalation of concerns to DHCS is something that's important because I've never seen policy so dynamic in terms of the feedback from how it's being implemented in the field. And the way that happens is through the CPIs. And so if services aren't getting to the people that they're intended, that information comes in, shared, and gets shared back up to DHCS, so those changes can be made. But like I said, there's many work groups. We spotlight and highlight providers, but there's many ways in which the CPI shows up and is effective for those that participate, as well as what we do together to advance implementation of CalAIM. Let's go to the next slide. Go ahead.
Okay, this is a fun slide, so we'll talk through this a little bit. So part of it is, our CPIs, we're trying to create the systems of care. We're trying to identify what's working, what's not working. And so we often list our challenges and then, of course, what we're trying to work towards. So we have a lot in the slide. I think Rick and I are probably similar in that we're really trying to look at where there are gaps in services and how can we work to fill those gaps as a community. So thinking about bringing folks into the CPI, and again, we have monthly meetings, we have office out, we have all kinds of things that come with the CPI, and we'd love to have all of you join us. And I think, again, looking for providers, looking for folks who are willing to contract with the managed care plans, looking for folks who want to be referral partners, who want to be capacity builders. And I look at the counties, especially for that, of how do we start to build capacity, raise awareness of what ECM and community supports are and how they can benefit folks in the community. For future aspirations, I think we just really want to have providers that are engaged and who are working with eligible Medi-Cal members to get those services that they need and that are available to them. And again, there's a lot of services. Community Supports has 14 approved services, housing. There's several housing components of that, which is really exciting as we face a crisis in homelessness. And then I think just we want to have a growing number of providers that are working together to really build a healthier population. Rick, I will let you add on to that, and then you can do in the cited piece here too.
Yeah, I think we feel a sense of urgency right now because there have been 3 rounds of cited funding. 2 have been announced and are in the process of being paid out. And the average award is, it's about $1 million. If you look at the number of organizations that receive cited and the total amount of the award, it comes right to around $1 million per award. And so what's interesting about that is a lot of nonprofit organizations are used to $50,000, $100,000 grants. These are significant investments that the state of California is making an investment in developing capacity and infrastructure. We know that there's organizations that could emerge as providers. We expect cited round 4, which will be the last round of this fall to be announced. So in order to be able to access that, an organization needs to get contracted. So if you're in an organization that is a potential provider, let us know as quickly as possible. We'd like to talk to you and kind of get you on that path, because we don't want to see any organizations that really need this investment to build out that capacity to miss out on the next round of sited. Because that's gone a long way in many of your communities to really build up small organizations to be significant providers of CalAIM services. So thank you for that. And I would say our challenge is really, how do we provide both broad collaboratives and add value to participants, and then be there for you in community-specific collaborations that need to happen. And in our collaborative in particular, there's probably 5 or 6 sub-communities in there that have their own collaborative work to be done. And on request, that's something we also provide in terms of support. And our work is all funded by the state of California. And so therefore, we're a resource that's basically free to participants. So there's a lot of funding and support, both from the managed care plans, the state of California, to provide organizations who have the desire to advance in providing these services, to find a way to do that with substantial funding.
And I'll just add on to that. I think, everything Rick said is absolutely correct. And what we've heard from a lot of providers is the past cited funding has been just instrumental in enabling them to really build the infrastructure they need to be successful with these programs. And so I really encourage folks, if you are kind of, should we become a contracted provider for these services? Should we not? We're on the fence. I really encourage you to think about that, so that when this round 4 cited application window opens, we expect it will be October, the fall, that you've made a decision. So if you do want to become a provider, you can jump in and take advantage of this last round of funding.
And can I just jump in real quick too, since we also at Phil facilitate another region, we have heard from the cited team that they anticipate that the round 4 application will be very, very similar, if not the same, to the round 3 application, which is currently available. So you don't have to wait for it to open up to start kind of preparing what information you might need for the application.
Great point, Catherine. Thank you. Do we have time for a few questions here, or should we continue on?
I think we're running just right on time. So I think maybe if we want to go to the next slide. I know Megan has dropped a few things in the chat, but as part of sort of the process, you have to register for your regional collaborative, and the link is here. And then I think for questions, you can contact your corresponding collaborative directly, and the emails I think have already been included in the chat. But if you have any questions, I do encourage you to put them in the chat, and hopefully we'll have time to circle back to them. And if we don't, we will share them with Rick and Gretchen and get responses to you as soon as we are able. Well, thank you, Rick and Gretchen. We really appreciate you being here. And I just have to echo that I really encourage you to connect with them and connect with your local collaborative, because it really is a place where you can get a lot of support and resources and information that can be incredibly helpful. So next slide, please. I'm very excited to introduce our next speaker, who's going to talk about the Children and Youth Behavioral Health Initiative. We are joined by Dr. Sohail Sood, who is the director of the Children and Youth Behavioral Health Initiative, and also an associate clinical professor in the Division of Pediatric Hospital Medicine at UCSF, and also with the California Health and Human Service Agency. And I believe, Dr. Sood, you're going to be sharing your own slides. Is that correct?
I am, yeah. Thank you, Catherine, and thank you all for being here. I'm excited to be here and excited to share more about this initiative for 2 particular reasons as well. One is I'm excited to share space with Melissa Stafford Jones. She is probably too humble to say this, but she was the founding director of the Children and Youth Behavioral Health Initiative, and is now, of course, with the Public Health Institute, but really just laid out such a strong vision and advanced the work in such important and strategic ways. So excited to share space with her, and then really excited to be with all of you, because I think this initiative holds a lot of promise in rural communities in Northern California. And when you look at the data, right, of how our kids are doing from a mental health perspective, the numbers of, let's say, completed suicides, for example, they're expectedly higher in urban centers, just because there's more people there. But, I'm sure all of you are well aware the rates, by and large, are higher in rural communities. And we need to learn more about what that's like for all of you and learn more about how to best support all of you with this. And so with that, let me just pull up my slide deck and we'll go ahead and get started. Maybe Catherine, just confirming you can see it. Things look okay?
Yeah, looks great. Thank you.
Awesome. Yeah. So when you registered for this webinar, I got a list of the attendees and some of the data around how familiar you are with the initiative. And these are your numbers here. So by and large, more than half of you essentially said that you're not at all familiar or slightly familiar with it. And that's kind of the audience that I'll be pitching to here at this point. But hopefully for those who are a little bit more familiar, you're also gaining something from this. Well, let me start just so high level. This is a roughly 5-year, in some instances significantly longer than that, initiative from the state of California, funded by the legislature, so by the people, of more than $4 billion of investment to really transform the way we support children, youth, and families. And to do so in a prevention-oriented way, which I'm very excited about, but also youth-centered and really equity-focused. I can go through all the work streams, and time permitting, I will, but let me actually just start with the story to paint out the vision of what we're hoping to do. So I want you to meet Monica. She's fictitious, but a composite really of many patients that I've taken care of throughout my career, and maybe resonates with those who may be in your community as well. She is raised by a single mom who works in a low-income job, let's say a gas station attendant. She's very close with her extended family. And over the course of her childhood and young adulthood, she loses a few of her family members. Her grandma dies from diabetes at a young age. And her uncle, who she's really close to, is incarcerated at some point. And this rocks her quite significantly. And so the question is what is this initiative trying to do, right? What are the changes we're trying to make in terms of mental health and substance use and behavioral health more generally? And the ways that we're going about it really start right from birth. So when Monica is born and she sees her pediatrician, Monica's mom actually can get screened for postpartum depression, can get screened for anxiety, and receive services at the pediatrician's office. We all know that, or at least I'll speak for myself, I'm more likely to take care of my own children than I am to take care of myself. Children see their pediatrician roughly on average 12 times within the first 3 years of life, and most adults don't, right? So these are opportunities to really surround not just the child, but the caregiver of that child with mental health and substance use services as well. So things start really right from there. And then from there, after leaving that doctor's office, Monica's family, and her mom in particular, gain skills from a program that's now available in her community. And even in many parts of rural California, so positive parenting program, for example, being scaled through the Department of Healthcare Services with a number of First 5 agencies receiving awards for that in rural California. She also received some support from Promotora services that are now available in her community. For example, Level Up NorCal is one of the awardees of that grant here. And in between these visits from professionals, she gets on her phone and she starts to unpack whether Monica's mom starts to unpack whether her kids' tantrums are really that and within the expected realm of normal child development, or whether there's something behind that. And she can do that by communicating and contacting a new app that's been developed called Bright Life Kids, where parents and caregivers can have a chance to talk to a professional at their own convenience, often in their own language and outside of regular standard business hours. So all of that are some of the ways that we're hoping to support her in infancy and in young childhood. And then Monica grows up a little bit and she goes to school. And in that classroom, she is now learning what's called SEL, so social and emotional learning. She's learning how to care for herself, proper breathing techniques when she gets anxious for any particular reason, understanding how her emotions can be connected to actions. Her teachers are teaching that curriculum in her schools in a more evidence-based and effective manner. Not only that, but her school staff, including her teachers, are learning themselves about the biology of stress. They are learning what it's like to create safe, stable, nurturing relationships. And that in turn, and the science definitely shows this, that increases Monica's sense of belonging. She goes to school more often because she feels like she belongs there. And also on her campus, there's a new face. There's a certified wellness coach now on her campus who helps screen students for various conditions, provides a welcoming presence, and in fact helps to coordinate and run the school's new wellness center that's on campus. And in fact, that coach is the one that recognizes that the levels of anxiety or the way Monica's reacting in the classroom are such that she could really benefit from a more directed clinical level of services that are now available through her school. So on or near site by her school health team. She grows up some more. She now hangs out at a new youth center that's available in her community. And she now has a phone herself and uses a different app where she can connect more privately and independently with a professional to talk through any issue, ranging from relationship drama, family drama, anything of the sort. Her friends at school are learning about the warning signs of suicide. They're learning about different resources that are available for her. And they are actually the ones that check in on her. And they're the ones that sound alarms when, despite everything that I mentioned, the data shows that some folks are still going to need high levels of support and higher acuity services. And she gets those services at a treatment facility, a residential treatment facility that's now in her area, so in her region. She recovers from that event and now remains connected with a therapist that's now available in her community. And instead of waiting 6 months to see her psychiatrist, her primary care physician can pick up the phone and call a psychiatrist for some support, but the primary care doc can actually manage her medications and feels more comfortable doing so. She also starts to realize that her relationship with marijuana is such that it's really impeding her professional development and her personal growth. And so she learns some harm reduction skills from a neighborhood organization that helps to support her in recovery through that. And she goes on to a community college where she receives a paid internship to work in the area of behavioral health and in counseling. So that's a sense of what we're trying to do through this initiative. Everything here that I'm highlighting is being funded by the Children and Youth Behavioral Health Initiative. So a smattering of the different offerings that we have. To provide it in a little bit more of a sector-based format, this is the way we're looking at things. We realize that if you start at the doctor's office, you're too late, right? In the areas of mental health and substance use, you really want to work with where the places that we live our lives, which is in the healthcare setting, but also schools and colleges, homes and communities, and certainly in the digital space. So to go through this a little bit more, and it's not a one size fits all. So recognize that certainly the path ahead looks different for different communities out there. But in the healthcare setting, we are really working to expand the behavioral health workforce, which includes expanding the number of slots in training programs for psychiatrists, for psychiatric nurse practitioners. We are building and establishing new bachelor's and master's level social work programs. And the one that I wanted to highlight for you, as I did in the anecdote about Monica, is we are standing up a new profession in the state called a certified wellness coach. In some cases, these may be individuals that already work for your organizations and work in your schools, but the codification, the creation of this certification really allows pathway toward them being essentially ordained as a healthcare worker and thereby being eligible down the road for sustainable funding mechanisms through the healthcare system, so through managed care and other processes. Also in the healthcare space, as I mentioned, funding $480 million has been awarded through the BCHIP program, the Behavioral Health Continuing Infrastructure Program, to expand and construct treatment facilities, and all of the above, inpatient, outpatient, school-based facilities, you name it, as well as different mechanisms to facilitate access to care, again, that support both the caregiver and the child. And then I mentioned a new platform that we've just stood up that's really for healthcare providers to be able to consult with a specialist no matter where you are in the state. So if you're taking care of someone ages 0 to 25, for example, me as a primary care physician, and I'm concerned about which medication or whether there's a side effect or how to make the best diagnosis, I don't need to just refer that child. I can build up my own skills by speaking with a licensed specialist, a psychiatrist or a psychologist. So that's a little bit in the healthcare setting. In the homes and community setting, this list here represents close to $500 million also of many different grants that have been awarded throughout the past few years to really scale evidence-based and community-defined practices. And also funding has been awarded to build up that workforce that works in communities. For example, peer support specialists, right? Those who've had lived experience with addiction, with mental health challenges are really sometimes best positioned to support one another with a little bit of training and with employment support. So the Department of Healthcare Access and Information has released a number of grants that have supported that type of work. In schools, a lot of work is being done. And in that survey of those who are familiar with it, I was pleased to see a number of our education partners, some of whom may be on this call, were among those who are most familiar with the Children and Youth Behavioral Health Initiative. But we're talking about advancements in the classroom, as I mentioned, advancements to support campus culture. And another one that I'll highlight is soon we will be awarding grants to look at peer-to-peer support programs, because we know kids really benefit from talking to other kids. Actually, that probably applies for everybody. I talk to my friends more than I talk to my doctors, right, about how to support one another. So looking at really what's the evidence behind that type of approach. And then also doing our best to increase access to care on campus. We spend 6 to 8 hours in schools, and so that represents an opportunity to really link people to the care that they need, oftentimes regardless of what type of insurance that they have. This is a massive change to the infrastructure of schools. And so funding has also been awarded to both education partners and those in that ecosystem to incentivize partnerships, to break down silos and to increase collaboration there. In the digital space, I mentioned the 2 apps that the new virtual service platforms that are now available. You can go to a phone right now and download these, or on your computer as well. Bright Life Kids is again for parents and caregivers of those ages 0 to 12. And then Saluna is available for teens and young adults for those who are 13 to 25 years old. And they're designed with similar content, but very different styles to really appeal to these different audiences. The youth in particular told us they wanted a greater degree of anonymity. And so that's built into Saluna. You don't have to give information if you don't feel comfortable doing so. And all of this is really only going to make a difference if we feel comfortable talking to one another, if we feel comfortable accessing different services and supports. And so a number of different communication campaigns are out the door and forthcoming to really further that type of messaging that we all need to hear if we're going to embark truly and authentically in this culture change. And so hopefully in your communities, you're starting to see billboards and signs and commercials and ads around this one. This is around suicide prevention for youth. And what the youth told us in designing this was they said, please talk about it. Please talk about what's happening in our communities, what's happening to our friends and our family, but do so with hope. And so you can see that with the color scheme and the directions here. The other thing that came out quite prominently in the focus groups was that feeling of being a burden, the feeling that my parents have a lot going on, others have a lot going on, so I don't feel comfortable sharing with them because I don't want to burden them. And therefore came the name of this campaign, which is Never a Bother. So you can go to neverabother.org to learn more here. And the other campaign that is now out in communities is called Live Beyond. And this is about adverse childhood experiences, which I imagine some of you on this call may be aware of, but we really need to move this from I would say the clinics and the libraries to the streets. Everyone needs to learn much more about what this is. And as the tagline here says, that you can live beyond it. So by plugging into services and supports for yourself, they again don't always need to be medicalized. You can really live a full and amazing life despite what happened to you as a child. There's also a number of different principles to which we hold ourselves accountable, which is including really changing the way we work, very much aligned with some of the work that's happening in CalAIM that Rick and Gretchen just presented on about the different ways we really need to coordinate across ecosystems to make this happen. We are doing our best to hold youth at the center of all the program designs and co-creation. And equity is really foundational. So as I mentioned, everything online is free and accessible in multiple languages. A lot of the work being done in workforce includes incentivizations to really get the workforce into the communities where it is needed most, including in Northern California. And then also each program has a slightly different take on this. But in general, there's a focus on priority populations as defined by the California Reducing Disparities Project. And so with that, I will stop. I'll put a few links in the chat, including a new webpage that we've just designed to, well, actually, maybe I'm looking at you, Megan. Do I have a second to share a webpage as well?
I just put the impact webpage.
Oh, perfect.
Yeah, if that's what you were referring to. Yes.
Yeah. So I'm just going to share that page that Megan put the link in the chat for, and thanks for doing that. This is a brand new web page for you to really learn about what's happening in your communities. And so you can scroll down a little bit and hear about some of the stories of what's happening. And I know First Five Tehama's here, so very excited about that. But then also at the bottom here, you can see actually what's happening in your county. And as I mentioned, many different awards doing many different things. And so you can search by award if that's helpful to you. You can search by county or just click on the county, or you can look for a specific organization through the search bar. And our hope is that helps you to connect with one another, and that helps you to break down silos as well. So I will stop there. Thank you so much for your time, and I'm happy to stick around and maybe answer a few questions in the chat as we pass it over to one of my colleagues, actually, Rachel, who'll be talking much more about that specific training that we have for school staff, early childhood educators, and really anyone who's working with youth.
Yeah, thank you so much, Dr. Sood. And as he said, our next speaker is Dr. Rachel Gilgoff, who's going to be talking about the Safe Spaces training. And she is a child abuse pediatrician and integrative medicine specialist and an advisor to ACEs Aware. And we're delighted to have you here, Rachel. And so I think next slide, you can take it away.
Yeah, thank you for having me, and thank you for all the fantastic presentations. I am learning so much and super excited about the work of this program and all the programs in California. So just to set the stage, I'm curious how many of you remember when you first learned about ACEs, adverse childhood experiences, and had that aha moment? And if you are so inspired, feel free to put it in the chat. For me, it was around 2012 when I went to a child abuse conference and saw Dr. Felitti speak. And I will say I had that aha moment and was really inspired and set about on, well, what do I do about it? And I felt like it was really hard actually to figure out what I as a pediatrician could do in my clinical practice. And I really just, what do I do about it? How can we prevent and heal? And so that set me on this stage of pouring myself into learning and action, as I imagine many of you did as well, right after that aha moment, as you are all ACEs champions here. And I say all of this because I'm here to talk about the Safe Spaces training, which is really that what to do. It is all about learning and action. And so just to look at the history and the collaborations that led to the Safe Spaces training, just going back, 2015 was Dr. Nadine Burke Harris's TED Talk, and over 12 million people have viewed it now. inspiring all of us to really take the science of ACEs and put it into concrete action. And that's what I've heard all morning, right? Is concrete actions and strategies and partnerships and learning together. And I am just beyond excited and inspired by this morning so far. You know, and then 2019, as California's first Surgeon General, Dr. Nadine Burke-Harris partnered with Dr. David Bouchon, Dr. Karen Mark, the Department of Healthcare Services, and they launched the ACEs Aware Initiative. And again, that's putting it into action, these strategies. It was the first in the nation effort to promote early detection and intervention to mitigate the health and societal impacts of ACEs and toxic stress, concretely providing funding for screening to clinics, to networks of care with grants, training and implementation tools, and a whole website, and just really galvanizing all of us to do, right? Learn and do. In 2021, UCLA, UCSF, ACEs Aware Family Resilience Network, UCAN, took the reins from Arera Health Group to implement the ACEs Aware Initiative. In 2022, Dr. Diana Ramos, who's now the current California Surgeon General, so she took office from Dr. Nadine Burke-Harris and continued, again, galvanizing us for action, lifting up her expertise, reproductive and maternal health, so that, you know, really inspiring OBs and more adult care medicine providers to address ACEs, and continuing with highlighting the need for mental health services and access within California. And so from all of these partnerships and inspirational leaders working with West Ed and with $1 million from the Children and Youth Behavioral Health Initiative, which we just heard so many great things about, came the Safe Spaces training, and that was launched in 2023. So we could look at the next slide to just really say Safe Spaces. So the full title, Foundations of Trauma-Informed Practice for Educational and Care Settings. It's a free 2-hour online training, and it's designed to help individuals who are working with children and youth recognize and respond to signs of trauma and stress. And it's really foundational for helping schools become trauma-informed and be able to be and offer a sanctuary of safety and support for young people. And so just to kick it off, I want to play a short video. We'll play a video. So that's next.
Stress and trauma have a profound effect on young people's health, development, and ability to learn. That's why it's so important to create an environment for our children and youth to thrive. The educational and early care workforce play a vital role in creating these safe and nurturing spaces. Introducing Safe Spaces, a free online training from the California Surgeon General that provides education and early care personnel the tools they need to recognize and respond to stress and trauma in children and youth.
What the science clearly shows is that the antidote to toxic stress is safe, stable, and nurturing relationships and environments. And what that means is that everyone who interacts with young children has a really important opportunity to be that source of buffering.
Being trauma-informed means being aware that ACEs and toxic stress are common and that they can impact our mental and physical health, our behavior, and our overall well-being. The Safe Spaces curriculum provides that understanding, that awareness, but also concrete tools and strategies that we can use to help kids, families, and ourselves to address ACEs, toxic stress, and those everyday stressors that we all face.
Access Safe Spaces online. Choose your training module, each focused on a different age group, and gain the foundations of a trauma-informed practice within 2 hours.
When it comes to supporting kids experiencing ACEs and toxic stress, it just takes one caring adult to be the difference for that child.
So whether that person is the custodian, a paraprofessional, a bus driver, a teacher, an administrator, a counselor, we can each play a valuable role in supporting the students that we serve.
We have the opportunity to reimagine mental health and emotional well-being for all children and youth. Take the training at www.osg.ca.gov/safe spaces, because everyone needs a safe space.
So just to dive into some more details after that video, it's offered in English and Spanish. Again, it consists of 3 modules, 2 hours each, focusing on different age groups. So depending on which age you're working with, you could take the 0 to 5 training, 5 to 11, 12 to 18, or all of the above. So you could choose. There is CME and CE credits available for doctors, nurses, psychologists, social workers, nurses. I said nurses twice, educators. And then you can receive 6 credits total for taking that training. It lives on 2 sites, so you can get to it through the OSG website. You can also get to it through the ACEs Aware Learning Management System. And so if you look at that QR code right now, you could get to it, but you could also find it again on ACEs Aware or the OSG platforms. And then you would just need to create a login to initiate the training, but that's pretty easy and self-explanatory. Next slide. A wonderful feature of the training is that it's designed for anyone who interacts with young people, so inside and outside of the education setting. So educators, early care providers, counselors, bus drivers, custodians, librarians, lunch attendants, school nurses. It's really a whole staff approach that's represented in the training. And so even in this example on the screen, you see a screenshot of a school counselor, a paraprofessional, and an administrator all working together and talking about ACEs and toxic stress. And really, on the next slide, we can expand on this theme a little bit more. So it was created with educators, schools, and school staff in mind. However, the material really speaks to anyone who is working with children. So that could be coaches, mentors, tutors, wellness coaches, case coordinators, promotoras, community-based organizations that support youth like YMCAs or Boys and Girls Clubs. So really, again, anyone that's working with children could use and appreciate this training. Another really nice thing is they've created an individual, collective, and systems level approach to training. So as we're kind of describing, individuals can take the training and you could do it as a collective. So a department team or professional learning community could take the course collectively and discuss along the way. And they actually created a facilitation guide to help you do that. And then thinking even on a systems level, it could be something that entire districts, counties could use to develop shared understanding and common language across different sectors, schools, roles, and different functions. So it really can be whatever level and as interactive as people want or need it to be. Next slide. So the training is designed to engage the learner with examples, concrete strategies and practices that vary according to the age and developmental stage served. And importantly, the training includes strategies for supporting the well-being of us, the adult care providers, and educational personnel as well. What I, again, personally love about it is the concrete strategies and examples. So it's really, after you take the training, it's what I can do today. It's what I could do in the next minute, the next time I see it and work with a kid. So it's very practical. And so it's helping people identify, what does an activated stress response look like? How could I, in my role, promote resilience and healing for that child that's in front of me right now? How could I respond to students who are stressed? So if I'm seeing a kid who's experienced and in the midst of that fight, flight, freeze response, what could I do right now? And it uses concrete tools like Dr. Bruce Perry's 3 R's, regulate, relate, reason. So I know, right, I can have in my brain, okay, first I regulate myself, help regulate that child through calm, soothing tone of voice. Then I can relate. I can be more, very relational, connect with a child, ask questions. I really want to understand, tell me more. And then I can get to the reasoning and problem solving. It's giving tools for us too as adults on how to calm our own stress response. So be able to regulate and self-regulate ourselves with pause, notice, and name. And it drives home conditions within our systems, within our schools that support well-being. And again, there's that facilitation guide. So organizations could do this as a group learning model. So very concrete, very action-oriented, which is why I love it so much. Next slide. The course uses realistic characters and scenarios to engage the learner and make the content relevant. So in this slide, you see a school counselor, a paraprofessional, and an administrator, and they're all trying to support Maya, a 6-year-old who's having difficulty with ending activities with those transitions when there's no prior warning. And so her stress response is to become upset, cry, stomp her feet. And then the Safe Spaces curriculum really goes through concrete strategies. So, well, what could we do? What could we do in that scenario? The training was, so next slide, the training was tested by more than 200 people. And there's, a lot of great testimonials and quotes that you can find on the sites. This one here on the left, Safe Spaces training can be a personal journey. I found it helpful to recognize and challenge my own biases, help me to better understand social issues and become more empathetic and open-minded as an individual. As of May of this year, we've completed 3,000 people have completed this training. So we're getting out there and it's getting into schools. And then the last slide, just to go through a few of the challenges, future aspirations, and connections. Funding was limited to curriculum development. So now that's why Safe Spaces, CYBHI, is partnering with the ACEs Aware Initiative to allow for that continued promotion and in-person training opportunities. And then, of course, there is that time commitment. It is 2 hours, so it doesn't seem like a lot, but when we're running busy lives and have lots to do, that 2 hours can be a barrier. And that's why I think of the supportive relationship stress busters, right? And doing group learnings can be one way to overcome that barrier. Future aspirations, get all schools trained, right? Let's try and help spread the word. We can support school districts with hosting in-person training for all staff if that helps support getting this word out. And as we've kind of talked about, thinking beyond schools, training other professionals that work with children, because it really is foundational. So that's this kind of connections. It really is a tier 1 support when using the MTSS approach for social emotional learning. It's closely aligned with the community schools model. It's really foundational, right, for creating schools that are safe spaces for our children. So thank you for having me here. I'm just really impressed with everything that all of you guys are doing, this whole community and all the speakers. Thank you.
Thank you so much, Rachel. And I think we had someone else from Safe Spaces join our summit, and that was there was so much interest in this Safe Spaces training that we're excited that you were able to share a little bit more with us today. So next, we're going to spend a couple minutes talking about the California Community Schools Partnership Program, and we are joined by Rosemary Mitchell, who is the program director from the Regional Technical Assistance Center from Community Schools. Rosemary, thank you so much for being here.
Hello, everyone. So excited to be here today and so happy to see a few familiar faces on this call. I could talk about community schools for hours and hours and hours and hours, so I'm going to try my best to give you a bit of an overview. And as always, please feel free to reach out with any questions afterwards. I'll put my email in the chat. But when we talk about community schools, you might have heard this word kind of thrown around. What does it mean? What does it look like? It is funded by a source of funding from the CDE called the California Community Schools Partnership Program. And community schools can be really hard to define because in reality, every community school looks a little bit different because it's based on our local needs. But a quick definition is a community school is a whole child school improvement strategy where the district and schools work closely with teachers, students, families, and partners. So it's really sort of turning the way that we've done schooling around in a way we're no longer working in silos. We are doing everything holistically and in partnership with folks across our community, right? And so the funding itself in California, you might have heard that some of the schools in your region have something called a planning grant, which is 2 years worth of funding to sort of get ready to implement this big sort of transformative school reform effort. And then we also have implementation grants, which you might also be familiar with, which are 5 years worth of funding. Down the road, we have 2 years of extended funding as well. So this is an opportunity for schools to have up to 9 years of funding to implement a change effort, which is pretty different compared to usually it's like, here you have 1 year of funding to do this thing and make this big change when we all know that change is slow. And so in that structure, the state has also implemented a structure for technical assistance, which is where I come into play. And so we have called ourselves the North Star Center for Rural Community Schools. We serve as the Regional Technical Assistance Center for the northern 13 most counties in the state. We're the only region that serves primarily and only rural places, basically. And we are hosted by the Shasta County Office of Education. And I'll go into more depth on each of these in a few minutes. Next slide. So the California Community School Partnership Program, there was $4 billion worth of investments, and it is designed to be implemented alongside all of these other initiatives that we've been talking about today, right? So it's sort of like these sister initiatives that sort of weave together in this way, but this $4 billion specifically is around the funding that schools receive to change the way that we approach partnerships, the way that we approach student services, the way that we approach family and community engagement. And it's based on 4 pillars, which are evidence-based. And so those 4, to repeat myself a little bit, integrated student supports, family and community engagement, expanded learning time and opportunities, and collaborative leadership, which I think probably rings true for a lot of folks on this call. And I will say the name of the funding source, California Community Schools Partnership Program, is a misnomer. There's this really common phrase that we repeat in the community school world, that community schools are not a program, right? It's not something we're adding on to do. It's the way that we sort of organize, the way that we think about schooling and some of the changes that we need to make. So community schools is a strategy, not a program, right? Changing the way that we do things rather than adding on something new. Next slide. So our target audience, community schools, is a holistic, overarching thing. So in my mind, our target audience is everyone. I think there is a way to include any single type of person, organization, entity in the way that we do community schools, because it's so partnership based and so community focused. But as always, students and families are at the center, right? And our holistic things, we're surrounding them by our schools, by our community agencies. County offices of ed are then another level of support. Local government can get involved in the way that we think about how we serve our students. Next slide. So we're going to touch on these a little bit, and then I'll dive deeper into what community schools are and what they look like. One of the challenges that I've seen with the way that we in California have implemented community schools is that, right, it's a very school-centric approach to community level change. So the community school framework requires that we partner across all of these entities, and we're really looking at sort of community level outcomes and changes that we want to see in the end, with education being like a major pillar of this. But we're trying to come together across the spectrum. But it can be very school-centric, because that is where our funding is going directly to, right, to our schools. Another challenge, which I think many of you might also be familiar with, is trying to think differently about the way that we partner and collaborate with different entities. Collaborative leadership, shared decision-making is hard to do in the structures that we currently have, right? The way that schools are and always sort of have functioned is sort of like a hierarchy, right? Like the principal is the person in charge of making all of these decisions, right? And it kind of goes that way. So we have to think differently, both as schools and community partners and parents and all these different entities, about the way that we're working together. Change is slow, but worth it, right? And some of our aspirations as the North Star Center for Rural Community Schools is that every school becomes a community school. Right now, the funding is targeting our highest need schools, as it should be. It is an equity strategy at its core. But we want to help all schools adopt a community school model, even if they don't have CCSPP funding. And so down the road, that's something we're thinking about. How do we support schools who have received this funding and others who have not or may not qualify for it? We only have one additional round of funding coming down the pipeline. But you don't need that type of funding necessarily to become a community school, but you need the right partners at the table. We need people to think creatively about how we work together and how we fund different endeavors. Funding, of course, I've sort of talked about this already. It's going directly to our schools, but our schools also have the opportunity to partner with folks. And some of that can be passing through funding, contracting with organizations like yours to do things when there are sort of consistencies in our needs and asset assessment that shows, hey, we actually really need help with mental health care, right? Or we really need help with fill in the blank, right? And figuring out how that all weaves together. I think we can get creative about our funding and how we use it. And then as far as connecting to many of our different things here, community schools are that sort of overarching strategy to figure out how all these different pieces fit together in our world. Next slide. And so community schools can be kind of difficult to explain what they are. Like the elevator pitch of community schools, I've been working in community schools for over a decade and I still don't have a great elevator pitch, so I apologize. But the question is why, right? Like, and the reason is that they are equity centered. It is unapologetically an equity strategy to ensure that all of our students have a high quality educational experience, right? Like, that's why we're here. That's what we're meant to do. That's the purpose of our public education system. And we are responsible for that, both as educators and other folks who partner with education. Another reason is that it's a holistic way of approaching schooling, right? It's not just reading and math. Reading and math really matter, but so does, everything else, right? It is evidence-based, so there is lots of research available about why those 4 pillars that I mentioned, as well as some of the other sort of ways that we frame community schooling. Like it shows that it changes student and community level outcomes when we implement it well. And I think one of the other pieces here that is most important for us, especially in rural spaces, the community school strategy at the school and district level are designed to be responsive to local needs, right? So it's not this top-down strategy coming from the state. They're not necessarily telling us exactly what to do. They're giving us a framework, an outline of saying, hey, this is like the research behind how we can make sure students and families do well. But you're going to conduct a local needs and asset assessment and figure out where in that strategy you're going to dig into first and in which way. So there's really a lot of ownership from our schools and our communities and our families about the way that we do this, which is a really amazing opportunity for our rural schools. Next slide. So as the RTAC, which is what we call ourselves, another acronym for all of you, we offer training and support. So on the training slide here, you'll see some examples of what we do, what we offer, different professional learning opportunities, and support is kind of the way that we approach it. I'll add into the chat. We have a mailing list. We're working on getting our website up and running, and it is coming very soon. We're not quite there yet, but if you are interested in hearing updates about our work, please feel free to join our mailing list. And you are also all welcome to attend any trainings that we have available to the public, and we'll share those on the mailing list and our website coming up. Next step. The North Star Center is made up of these 4 different entities. And what is most important for you here is that we work closely with North State Together, which many of you probably also do. But we also work closely with all of the county offices of education in our region. And so we sort of have like this hub and spoke type of model. We wanted our support to our schools to feel personalized and to be responsive to local needs, right? Like what's happening in Modoc County is a lot different than what's happening in Butte County and Humboldt County, right? And so we know that their support is going to need to be different. So depending on where you live and where you work, on the next slide, we have contact information for those county community school leads there. You are welcome to reach out to me. If you can jump, thank you. But these will be the people on the ground in your counties that if you're interested in partnering around community school work, these will be your go-to folks here. This is an example sort of figuring out, okay, so like, how do you operationalize community schools? Like, what does this actually mean in person, right? So there's a few different elements here of what we're asking our schools to do as they become community schools. And so we are asking all of our schools to conduct a needs and asset assessment. That's more than just your basic survey, right? Like we really want to use interviews as a relational tool to connect with parents and build relationships with them, and also get a better sense of what their needs are and what they think our school should be doing. And we can make connections and decisions with them together on some of those things. So another thing we're doing, which is important, is sort of a shared decision-making structure. So that might be called a school leadership council. It might be called a community school leadership committee. Often different community partners sit on those as well. And everyone sort of makes those decisions together. You're going to identify opportunities based on your needs and asset assessment, move into making those changes for your school, monitor your program and success. And so on the next slide, you'll be reminded that some of this is probably sounding really familiar, and that's because most of our schools already have elements of the community school model in place. Because what it is, we're asking the schools to be high quality schools, right? But what we're also asking them is to do better and to do it more collaboratively with our students, families, community partners, and so on. And on the next slide, this is just sort of like this kind of silly graphic to figure out how does this all fit together. So CYBHI, for example, is one way that we can fund sustainably the way that we're going to keep doing integrated student supports, right? We're sustainably changing our system and integrating all of these different other opportunities to become and remain community schools and transform the way that we do schooling moving forward. So please feel free to reach out if you have any questions. Happy to chat with any of you and see how we can support you in learning more about community schools.
Thank you so much, Rosemary, and to our other speakers. We just heard a lot of information, and I'm going to turn it over to Sue to introduce sort of some topics for a quick breakout room debrief.
Great. Thank you so much to all of the speakers. I mean, I just like need to take a deep breath and just absorb it all. And we thought it would be important to just spend a little bit of time in dialogue with each other, just to introduce yourself. And we have a set of questions just for prompts. I think we're going to put you in rooms of about 4 people or so, and hopefully you'll stay. I know sometimes I see people leaving when we do this, but it's such a great opportunity to try to make sense. Katie, could you move to the next slide? As we're doing this. So here's some example questions that we just thought, would be helpful. Like, are you involved in any of these, initiatives, and who are you collaborating? What did you just hear? What struck you? I mean, there's a lot of resources. We are going to be making sense of it and help to put that out. What do you want to learn more about as we're planning for the October meeting? I think we really want to hear from you. What do you really need? And then I think most importantly, how can we in our work of this Rural Resilience Innovation Hub facilitate further learning and implementation of these initiatives? When we come back, we are going to do a little bit of sharing, and then Melissa Stafford Jones, the new CEO and Executive Director of the Public Health Institute, is going to help us with a little bit of sense making and wrap up. So thank you. Katie, take us away. Welcome back. I'll just wait a minute before everyone.
Yeah, it looks like there's still folks chatting in the breakout room.
Yes. So before we turn it over to Melissa, I think we'd love to hear from a couple of you, just any reflections from your discussion. I welcome you to add any comments into the chat, or if you'd like to speak, we'd love to hear from you. Just any reflections about or takeaways from your conversation in the breakout room.
It was great to have the smaller group connection, Sue. Thank you for that.
Thank you, Matthew.
I'll add something, Sue. Oh, sorry.
Mhm.
Was I talking over someone?
No, no.
We had Alicia from Tehama County Library, and I was just really
Nice.
interested in her perspective, which is one that you don't hear a lot about, is the role that libraries play, particularly those who are unhoused and who are going to the library as a safe place. And so she was interested in the safe places training, which was an eye opener for me because I just never really put the two together. But when you think about the roles that libraries are playing, particularly too in our really areas with the climate change as well, extreme heat is in the north as well as, some cold, but the role that they play and that they're seeing more people with more needs than just checking out a book. I just thought it was really interesting. I hadn't really given that much thought.
Great, thank you. Thank you for sharing. Libraries are pretty amazing. So great.
I'll add to that. My name is Shane. I'm with Ventura County. I work at Public Health, and I'm in charge of the opioid overdose prevention project for our county. And libraries have just come online to have naloxone in their first aid kits. We have 20 something branches in our county, and so I'm really excited to work with them. They obviously have a very high population of, we have unhoused folks, we have young people, we've got all kinds of folks coming into libraries. So excited to offer that as a resource for the community and as a training point as well for people on how to use naloxone. So yay for libraries.
Yeah, right. They are pretty amazing. Jessica, thank you for your comment in here. I did address it earlier in the slides, but I will just briefly mention, right? This is, I'm going to call it a solution that came forward from the NAC steering committee in terms of looking what the needs are. And really, it's a prototype, right? We have said we want to create a space where we can facilitate knowledge sharing, exchange of ideas, also prototyping and experimenting. You just heard about a boatload of initiatives. And what we would like to do kind of next is to create a space for meaning making, but also how does it all work together? How can we implement that in the rural communities that are here today and maybe beyond? Thank you, Jessica. Melissa, I'm so excited for you to be here. Catherine, I'm going to turn it over to you to kind of launch this, and then we'll hear from Melissa.
Yeah, I mean, I think that was actually a really beautiful segue from Jessica's question to your response to handing it over to Melissa to do a little sense making. So Melissa Stafford Jones is the president and CEO of the Public Health Institute. And we're really excited to have you here today. So I'm just going to hand it over to you.
Thanks, Catherine. Thanks, Sue. Well, I'm really excited to be here today. It was a great session. Thanks for including me. And I do want to say, just because we were talking about libraries, I think libraries are magical places. And actually, I think when we think about multi-sector collaboratives, working in the space of health and social well-being and community, I think when libraries come in, it's almost like it's a great marker of sort of almost the maturity and the growth of a collaborative to have libraries at the table. So I loved hearing about that example. I'm so glad that libraries are a part of our gathering today. So I'm going to share a couple of reflections, a little bit of perspective, and maybe a little bit of a challenge at the end for the work that's coming next, that you all are continuing. I really appreciated the way Heidi started off by grounding us in Maya Angelou's quote around sort of when you know better, you can do better. And that sort of place of curiosity and sort of a place of a growth mindset, because I think that what we have found, and certainly what I have found across multiple sort of multi-sectoral cross-sector systems initiatives that I've been a part of over the years, is the starting point of change has to be in that sort of mindset place, that mental model of how we think about what's possible, and even maybe how we define an issue or a problem that we're trying to address, to think about it in new and different ways, and the ways in which by coming together and thinking across sectors that don't necessarily typically work together at all, or maybe not as in depth as you all are talking about doing here, that really is a very powerful approach. And it actually takes a lot of creativity and imagination to sort of imagine a different approach than what we have always done. Because I think that's one of the most challenging parts of this kind of systems change work and cross-sector work, which is, I often have a vision in my head of well-worn paths for these kinds of efforts and change. And it's so much easier to do the things we've always done or tried, because those are the well-worn paths. What's really hard is carving a new path, right? And that's why sometimes it can feel slow, or it can take time, or we know we have to build trust when we're creating something that's different than what we've done before, and everything we try may not work. I was actually, just interestingly enough, the way schedules go, I had an early morning call this morning with a colleague who's based in the United Kingdom who does very similar work around this. It's an organization called Weave in Europe and other parts of the world, but their sort of core, one of their sort of core starting points to this work is they actually start off with sort of like, they actually call it like an imagination seminar, because it moves people into that space of being able to imagine what might be different and what might be possible that's different than what we do today. And I think you all have already been doing that work, and you know, you're carrying it forward here today and opening your minds to the possibilities and all the tools that you might have to actually work with. I think the other thing that really struck me listening today that I think is so simple, but is really powerful in this work is how do we get to where the whole is more than the sum of the parts? I feel like that's just at a core, and I think that's such a, in my experience, it really is true. Like when all of the puzzle pieces actually are organized to fit together in a way that is really meaningful for communities, for families in this case, right? Focusing on children, the totality of the effort really can get greater impact than if each of you were just doing your own very best work completely individually. There really is potential in the wholeness of the approach, of that holistic cross-sector approach. And candidly, I think why we don't see more of it is it's hard. It's challenging work for a million reasons, right? Everything that creates the systems we work in is siloed. Funding, program structures, expectations, even like go way up, go back to your, you know, your high school civics class. Even government is organized in silos. There's a completely separate, you know, the federal government on down, right? The Department of Education is completely separate from any Department of Health. And yet kids' health and education and well-being is totally interconnected in their lives, right? And so when we're in this work of implementing all these different initiatives and doing what you all are trying to do, which is to come together in new ways to actually advance shared goals to improve outcomes, resilience, well-being for kids and families, you are having to work against the entirety of the structure that is siloed. Now, the good news is, right, we know from the collective impact literature that when you make it work, it's very impactful. It's very impactful in terms of changing outcomes. And I continue to think that we have to keep spreading this work, keep digging into this approach. And at some point we'll need sort of a sandwich strategy, and hopefully we can even change some of the larger sort of structures that make it harder and actually have those structures be facilitators for this work, rather than some of the challenges that you all are already working through. I think too, another area that really struck me listening today, and this was just alluded to, I think, Sue, you commented on this, you heard about a lot of different state level initiatives today. And each one of those initiatives is not just one thing. They each have multiple parts to them, multiple components on different schedules and different timelines. The thought I had as I was listening is that I would encourage us to maybe think about those as tools in the toolbox and to be grounded in, and it sounds like from what Heidi presented at the beginning, there's a lot of clarity in this group around your vision and your goals. And so how is it that maybe you can think about all the tools and initiatives you heard about today, and rather than sort of turning your attention to, well, what are we going to do about that? Go back to, I'm a big work backwards kind of person. Like, what is it we want to say we did in a year or 5 years? And then how do I work backwards to get there? How do you take all the hard work you've done in the past year on your goals, on your vision, on your collective purpose, and think about how some of the tools you heard about today can work in service of those goals? So rather than having to chase all those things you heard about, because I just, there's not enough hours in the day, right? Everybody also needs to take care of themselves. So how can you think about it that way? So I just offer that as not so much a prescription, but maybe a food for thought around how you might take in and synthesize everything you heard about today. So rather than saying, well, how do we do everything we heard about in CYBHI or community schools or CalAIM, go back to your own goals and vision, particularly in terms of, and I think we heard about this from all of the different initiatives today, what is meaningful to your community? To your children, to your youth, to your families? What have they told you they most want to see be different? And how is it that you can pick and choose amongst some of these tools and these toolboxes and these efforts to sort of further that, and to, I don't even know what it would look like. I don't know exactly what your processes are, but to sort of have your partners in the community, maybe even helping to select or prioritize or think about those things that are most likely to advance the shared goals that you all have. Another piece of that I wanted to reflect on, and I'm guessing you've all seen this. I mean, there's lots of, if you Google it, there's lots of different like graphics of it, but I don't know if you've ever seen that sort of continuum of collaboration that often starts at sort of like competition, or sometimes it starts at information sharing, and then at the other end is actual integration, like where you have shared decision making, you're sharing resources, you're sharing power. And I think one of the things I thought about today as I was listening to the presentations, and then even a little bit in the breakout group I was in, was this is the challenge part, challenging ourselves to think about how do we actually move along that continuum as part of this work. Because we do know that information sharing and shared goals are powerful and critical steps to build. And I don't think you can go from one end of the continuum to another, in one fell swoop. You sort of have to go through each of those stages and phases of the work. But I also think a lot about, at the end of the day, people, families, communities are whole entities. Like, I spent many years working in safety net healthcare, and sometimes I felt like saying, this issue doesn't reside in somebody's left arm and this one in their heart and this one in their brain. They're whole people, and anything we're doing has to think about the whole. So is there an opportunity through this work to challenge ourselves to think about, with all the amazing people on this call, the expertise they represent, the systems they represent, the resources, the strengths that we heard about at the beginning that are represented, what could that look like if we challenged ourselves to think about if they were truly more integrated for families and communities, and that it felt almost seamless, like families wouldn't know if the county behavioral health department, a First Five, a school, or a library, had anything to do with some funding or program through community schools or something else. Like, how could it be completely seamless to them? What it felt like was, we holistically support our families and communities to thrive and to be resilient. And so what does that look like? And there are some really amazing examples in California and other places around that work. I will say it's challenging. Like, it takes ongoing governance. It's never ending work, right? Like, it's never ending work because of that. And then, and one thing that I have seen with that, when it's really working effectively, I want to share it. I'll sort of close with this thought, is I've had sort of a shift in my thinking around some of what it takes when this kind of cross-sector systems work is truly and deeply impactful and sustained over time. And for a long time, I subscribed to the view that I had a colleague who I think just, she captured it perfectly, which is she said, we really need to move from dynamic leaders to dynamic systems. Because one of the things we all know is sometimes this work takes off when candidly people like all of you are in their roles, like being the drivers of this incredible work. And then when you go to do something else, it can lose its steam. And so this idea was, okay, we need to move from dynamic leaders to how do we embed this in dynamic systems? So the system itself sort of owns that. And I still believe that, but I've had a shift of view around it because the reality is in the kind of work that we are all a part of, systems are mostly made up of people. There are tools, there are technologies, there are tangible things that are a part of it, actual resources, concrete resources that are inputs or outputs of it. But so much of the system itself is people. And so my own view has evolved to say, what really we have to do is redefine what we expect it means to be an effective leader. And I don't mean leader just in a formal position, I mean sort of in any level of the work. And that it's that we're sort of redefining the idea that an effective leader might be somebody with blinders on who's only expert in their own system. That we're redefining that meaningful leadership in this kind of work means having a mindset and a set of skills and a prioritization of working with other systems, working across sectors. You still have to be effective in your own lane and system, of course, right? But one of my education colleagues that I had a chance to work with closely in another role over the last few years said, when you're a school district superintendent, like when kids need something, you think about how you can do it. Like that's what your job is. You think about what you can do in that role. The first thought is not, I wonder what other partners I have in the community that might be able to fulfill that role. And I don't say that because I don't think that's true of just K through 12 schools. I think that's true of all of our systems. We think about what can we do? And I think this is where we have an opportunity, and you all are doing this right now, which is creating a different kind of approach in a community that says we as leaders want to bring our expertise and what our program or our organization or our system can bring, but we want to do that in concert with others who are working towards shared goals and do the hard work of how we actually bring that together where the whole is more than the sum of the parts, and that we're going to model that. And the beauty is, of course, today's challenges are today's challenges. We're going to have new challenges in 10 years. We have challenges today that we didn't all foresee 10 years ago, but that approach can serve us on the next set of challenges that arise too. So thanks for having me. Thanks for letting me share some reflections. I'm super excited to see where the group's work goes and where we have innovation in this kind of work so that we can really continue to scale and spread the kind of cross-sector work that you all are taking on here. So thank you.
Well, thank you so much, Melissa. And I know we're just about at time. And Katie, I don't know if you could pull up the slides. So just really quickly, we will be popping in the chat a link to a post-event evaluation, and we really do request that you fill it out. It's going to be incredibly helpful for us. And we would love for you to join us as we move through this next adventure. You can sign up for our NAC newsletter. You can become a NAC champion and come to our quarterly convenings. We're also looking for new steering committee members. So if you're really excited about what you heard here and you're interested in joining us and being part of our steering committee to help map out this next year, let us know. And that is actually included in our evaluation survey. And also in the evaluation survey, we really want to hear from you what you're interested in digging deeper in, what you want this next year of 2025 to look like for the Rural Resilience Innovation Hub. Because really our goal is to design it and in a way that supports the work you're doing on the ground and really helps you be successful at your hard work addressing trauma and building resilience across rural Northern California. Well, thank you so much for joining us. It's been a big 2 hours, and we're so excited that we have some of you that have been able to hang out for the whole time, and we welcome additional questions that if you want to drop anything in the chat or reach out to us afterwards. And we hope to see you at our next convening.